Fentanyl is a potent synthetic opioid and it is used as an analgesic in anesthesia and to manage severe chronic pain. Unfortunately, in recent years, it has been used illicitly in North America and Europe. The unmeasured and illicit use of fentanyl can cause several symptoms and, in the worst scenario, death. In Mexico, fentanyl is a huge problem because this substance can be bought legally in pharmacies and used for the wrong purposes. The problem resides in northern states, where more than 50% of the people asking for help had fentanyl in their medical examinations, and 70% of opioid users have overdosed for legal or illegal consumption due to the addictiveness of the drug.
Our proposal is based on the use of CRISPR and its uses in genetic therapy. The goal is to create a protein-based treatment that can be implemented in addicts as a way to combat their addiction to opioids such as fentanyl. This idea is based on the discovery of Dandan Wang and her team in 2019, where they found that the protein called GPR139 can be used as a negative regulator for the body's morphine receptors. Their studies in mice reported that the animals that were subjected to the technology had a reduced effect of morphine since the protein actively interferes with the binding to the receptors. We expect to implement the same approach to the gene RGS-Z1, which is naturally present in our genome. It produces the RGS20 protein that inactivates the G-alpha and G-beta gamma subunits, which play an important role in the effects that fentanyl have on the body. So even though the drug still attaches itself to the MOR receptor, the signal cascade that it produces would be stopped by the protein, since it would prevent the activation of the subunits. Thus, the drug effect of inhibiting pain signal transduction by stopping presynaptic and postsynaptic signaling are no longer efficient.
The goal is to subject patients to gene therapy to reduce the effects that fentanyl has on them in the hope that it can reduce their dependence on the drug, this being additional to the conventional anti-drug methods such as rehab. The proposed treatment also aims to reduce the probability of a relapse in those patients who currently are struggling with the addiction. This will be achieved by the reduction of the current effects of an opioid. Currently, fentanyl is one of the most consumed drugs in the entire country, reason why we propose to implement this gene therapy throughout the Mexican health sector, whether public or private, reducing and managing the possible addiction to the actual drug.
These proposals represent a development with a strong impact. If these techniques are implemented in the future, will contribute in different areas of approach. It could complement rehabilitation. Also, it offers the potential for individuals to better manage their addiction. The treatment could contribute to preventing overdoses and reducing occurrence of severe side effects associated with illicit fentanyl use. This approach could also have a social and economic implications by reducing the charges associated with the opioid addiction, reducing healthcare costs, and improving productivity as individuals overcome their addiction and contribute to society.